Paul Shannon, I'm a manual osteopath based out in Squamish in British Columbia. Obviously, I'm originally from Scotland. I'm also a physio master of many sort of things, or not a master, but a few different qualifications. I'm a manual osteopath. I'm actually a trained physiotherapist from the UK as well. I'm a soma therapist, which is another side part to the ELDOA. I'm a soma trainer, which is another kind of part to this kind of training, and also an ELDOA trainer and certifier. So there's kind of loads of different things all mashed together, and I just call it therapy, based under the name of being osteopathy. What the ELDOA is why everybody's here, because a lot of people don't know what it is. It was created by this guy here. There's a guy called Guy Voyer. He's a French osteopath based out of Marseille. Not a lot of many people know about him, but he's kind of a very amazing therapist that's came up with a lot of different techniques. He's a classically trained osteopath from multiple different schools. He's got degrees in medicine, sports medicine, physical therapy, physical education, traumatology, and biomechanics. The whole, like the list that you see, or once you come to the course, the list of his credentials is pretty extensive. And he's kind of, again, put all this stuff together and came up with these kind of amazing techniques. And one thing, when he was doing all these training, at that time, back pain was a big issue. And that's where he decided, I need to find out and make an exercise that's going to really work for ELDOA. And what he did, he went around and studied from many different people, as we're doing, hence we're on these courses, and kind of collected loads of different things from different people and used a lot of biomechanics, anatomy, and fascial dissections, and kind of created this amazing exercise technique. So basically, what is the ELDOA? You're all here to kind of find that out. If you throw questions into here, if anybody's actually done ELDOA, you've probably seen it on the internet, you might have been to a class, or you've just heard other people doing it, or you've had clients coming in saying, hey, I want to do this. The main thing about the ELDOA is the name. It's a French acronym for the word LOADS, is the easiest way to say it. It's longitudinal osteoarticulated decoaptation stretching. What is this? So basically, the ELDOA, the idea is we're going to use fascial chains to kind of create space between two joints. Primarily, we're going to work on the spine. So we want to create space between L5 and S1. We're going to use fascial chains to put tension onto the top of the sacrum and tension onto L5, and we're going to pull them apart. Lots of good things happen when we start to do that. A couple of the benefits when you're doing the ELDOA is we've got things that we're going to help work on and help release. Here, we've got the facet joint tension. When we pull, the goal of the ELDOA is the goal of the facet joint is to create guide and create movement. Yeah, when there's pressure and compression, then facet joints are going to be more together, stuck. So we want to create more space. If you have more space, you create more range of motion. If there isn't space, we start to get more friction, kind of get rust in between them facet joints. There's a kind of a rule, or we'll talk about laws as we're going through this, but one of the laws is Delpesh law. And that law is the more pressure you have on a joint or a structure, you're going to get more production. That production could be things like osteoarthritis, it could be osteophytes, all this kind of stuff that happen in the spine that we see in x-rays that people have pain. So the great thing is about the ELDOA is we're going to try to create space and space around the facet joints to create that movement. Another interesting thing about the facet joints, I don't know, we've probably got chiropractors, physiotherapists, and all this around here. Facet joint is the kind of main area what you'll do your adjustment with. And with that adjustment is because that is the physical joint in the spine. So if we can create space between the facet joints, that's going to allow that greater range of motion. There's also space in all the facet joints because each one has a different angle. And that angle changes as it goes up the spine, so we want them to become free. You talked about the facet joints. They're joined two vertebrae. In between the two vertebrae, we've got the disc. One thing about the disc, if there's no space, the disc gets compressed. Now, when the disc is compressed, there's going to be no water inside that disc. The disc really needs the water. We kind of tell our clients, a good thing when I'm doing the ELDOA is the disc is like a sponge. When the sponge is all crushed up and squished up, it's not going to take any water. When you let go of that sponge and let it expand, it gives it space, so it can start really sucking in water. That's kind of the easy way we explain to clients. So going more physiologically what happens during the ELDOA and how that water inhibition happens. We've got here is we're going to get increased venous return. So basically, if you're creating space and you're going to start stimulating the spine, you're going to start stimulating the arteries, the veins, the fluid and movement of the water. So it's going to help with that. You're going to normalize the muscle tone while doing the ELDOA. What that means is normalizing muscle tone is actually a strengthening exercise. There's a few different ranges when you're training a muscle. But the ELDOA is really an exception of another range. So basically we put them into like 5 ranges. First range is total range. If I compare with the bicep, I'll do this one. I've just had surgery in my shoulder, so I need to kind of be easy what I do here. So the bicep, we have total range. That's taking the muscle through all its range. Then we have internal range, where the muscle is contracted and it's just a short range of motion. You have middle range, and then you have external range. So by doing these different actions, you train different parts of the muscle, and you can either elongate the muscle through strengthening, you can shorten the muscle depending on what you're going to do. The ELDOA goes to another level and it actually works in extreme range. That's when a muscle or accumulation of different muscles are taken right to their end. And it kind of works on the muscle sliding theory, the actin and myosin, and it kind of, when it takes that right to its end range, it's at that point it starts to lay down extra protein. It's very difficult finding what this extreme range is. There's not a lot of literature out there on there. We'll go into a little bit on the course, but it's kind of an exciting way of you see how that trains the deepest muscles that are in the spine. Another thing is what we do in the ELDOA, and really important, what I think, is it creates proprioception and awareness. The difference between proprioception and awareness is they're quite, people think they're very similar, but actually 2 different polars away. Awareness is you creating a 3D image on your head of a movement. Yeah, people put that as the proprioception, but that awareness is you're creating an image of where your hand is, where your arm is, how you move that. Can I take my arm? Can I bring it up? Can I touch my head? If you don't have the awareness, you don't move your arm. You don't know where your head is. So the first thing is you need to create awareness. The second part is proprioception. And I think the ELDOA it does the strengthening, as I said, with the extreme range, but proprioception is really what the ELDOA does. And the proprioception for me, and for what I understand about it, is creating that stimulation of the ligaments. And like the ligaments in the body, they've got loads of little mechanoreceptors, the Ruffini, the Golgi tendon organs, it's a tendon, but it's all in the ligaments. And as you stimulate that, you send that feedback so the brain realizes what that ligament's role is and improves the quality of the movement. And if you look at the spine, it's got thousands of ligaments, say thousands, lots, many ligaments all through the spine, front of the spine, the back of the spine, in the foramen, joining the transverse processes. So the idea with the ELDOA is we're going to start stimulating that. Sliding on here. And the one thing about the ELDOA, what it does, it was primarily created for back pain. Yeah, the spine isn't saying the spine is complicated, as a vital structure. Compression between the articular blocks can cause pain, it can cause arthritis and neurological conditions. The ELDOA exercises are a highly effective solution to these conditions. Like I said, we can create space. By creating space, you can help improve the motility of the fluid into the disc, surrounding the disc. We can create space between the facet joints. It's also creating space so the disc doesn't get pressed and start pressing on other structures. As an ELDOA, to create space, there's an improvement in the joint mechanics, there's increased blood flow, there's reduced pressure on the disc, a reduction of pain, spinal disc rehydration, better muscle tone, improved posture, and a sense of well-being, because everyone likes to feel good. But the ELDOA there's so much more to the ELDOA. as we first started to create it, Guy made it and he said he's doing it for back pain. But when he was treating people and then giving them an ELDOA as homework, they were going away from my back pains feeling better, but my actual menstrual cycle pains has improved. I had a bladder problem and that's actually improved. And Guy's kind of scratching his head and going like, how is this happening when we're just kind of creating space in the spine? And what we kind of forgot, what he forgot at the beginning, is the links of what the spine has to all the structures in the body. It's linked to the visceral organs, it's linked to the blood supply, the venous return, proprioception, and autonomic nervous system. There's so many different things. I've got a few examples of that going here, like it creates the autonomic nervous system innervations. The kidneys, if you just think of this, the kidneys are attached to the lumbar spine by a fascia called the Zucker-Kindle fascia. And the bladder attaches to the pubis by the pubovesical ligament. Now we can do an ELDOA and we can actually create a position that's going to affect these. And I'll explain that a little bit further. This is where I think the ELDOA gets really cool. So, you know the sympathetic, the parasympathetic system? Well, all the innervations for all these structures come from the spine. So if we can create an ELDOA or do an ELDOA for a certain area, like C7T1, you've got the stellar ganglion. That's the important part for the autonomic nervous system affecting the arm, the face. So if we can do the ELDOA for C7T1, we can stimulate that ganglion. And you can just go anywhere you want using your anatomy. Once you learn the ELDOAs, in this course, the first course that we're doing is all the ELDOA from the spine from C2 all the way down to L5S1. So there's many innervations that you can do, and you've got all these problems that people have, and as long as other treatments, you can give this home treatment or home therapy or home exercise for them to do to stimulate that themselves. In here, this is a transverse cut of the pelvis. And here you're going to see the pubovesical ligament that comes onto the bladder. Another pubovesical ligament that comes round to the bladder. These are on either side of the pubis. There's an ELDOA and further ELDOAs down the line that affect the pubis. So you can help if the pubis is off, because if the pubis is out of angle, here you're going to start putting a torsion onto the bladder. The same at the posterior side, onto the sacrum, you've got this sacro, I can't even say some of these words, the sacro-uterine ligament here. It comes up to here and goes on to the rectum. You've got people with digestive problems, right? Because the sacrum is out of order. We've got ELDOAs that can help to realign the sacrum over time. Here's this one I mentioned about the Zucker-Kindle fascia. This here is the kidney. You all see where my little mouse is going around here. In the front of the kidney, like, and surrounding it, is the renal fascia. Yeah, this surrounds the kidney. On the front part of the renal fascia, you've got Gerota's fascia. These are named after people, doctors. Yeah, so the Gerota's fascia is round the front here, comes round the posterior part here. This is the Zucker-Kindle fascia. Again, it's another man that found the structure and wants to name it. And this Zucker-Kindle fascia comes up, comes round and joins onto the lumbar spine. Now, if you've got a torsion in the lumbar spine, or there's an issue there, this can put tension onto this fascia, which can affect the kidney. So what can you do? You can do your treatments, might be visceral work, might be structural work. Then you can give your clients, there's an ELDOA for L3 that's going to help with the attachment of the Zucker-Kindle fascia, which surrounds the kidney. Also, you see how this here, psoas muscle, joins onto the spine. 5 different levels of there. If there's a problem with the psoas, you can help to stimulate the lumbar spine as well for your treatment for people not only stretching the psoas, they can be helping to open up space to allow the vertebra to be free from the disc, because the psoas touches and attaches to all the discs between T12, L1, all the way down to L5. It's pretty interesting when you see that. Fascia. Everybody talks about the fascia. As you've seen there, back on that previous link there, this is the fascia, and it's got the link. Yeah, it links round from the spine all the way around here. Yeah, we all talk about that. The fascia is the link. It's the link between all the structures of the body, making the body one global structure. Yeah, that's the thing we need to remember is when we're doing this and learning this way of kind of thinking is everything has an effect. Yeah, the spine affects visceral organs, the spine affects the disc, the spine affects the nerve. It all links up. Yeah. So here we go, we're going to go in a little bit about fascia. So there's three main parts of the fascia. Yeah, we've got cells, you've got the matrix ground substance, and you've got fibers. So in the cells, the main parts of the cells, you've got fibroblasts, and these are most abundant cells in the connective tissue. Their job is to produce the various types of fibers found in the connective tissue. You've got mast cells, yeah, which are associated with the process of inflammation and healing. And you've got macrophages, and they play a key role in the general immune defense in eating, thereby destroying microbes and cellular debris. Then you've got the matrix. The matrix is the ground substance. This is the viscous fluid that surrounds all the fascia. Yeah, it's really important this fluid goes round because our body is about 60 to 70% water. It kind of gets a little bit less as you get older, but our life is how that water flows. One of the main things that we can directly get into with the fascia is the fibers, right? And we've got the reticulin. So the reticulin is the thinnest, is a much more delicate type of fiber that's very flexible, and it surrounds in like your visceral organs, right? It's round in there. You've got the elastin. Elastin is the most flexible protein that can stretch up to 150 times the length, yeah, and without tearing and then come back. And then you've got collagen. So collagen is what we deal with when we're dealing with ELDOA and dealing with hands-on therapy. So the collagen is the thickest and strongest and most abundant protein in the body. It's interconnected, and it works in kind of three ways. And it's like three little tubes that are intertwined together. And the importance of these tubes is the collagen tubes carry water. And that water is the water of life. And that turns around through all the fascia. And the goal when you're doing an ELDOA and putting things into tension is to try and straighten out these tubes to allow this water to flow. Has anybody got everybody with me so far? Has anybody got any questions? No. So all this connective tissue, except the bones, is organized in the shape of the fascia. The envelopes round in sheaths and septums and support membranes, separating sheets of the attaching points. All of the connective tissue is suspended in a bony network. The fascia are organized in layers. Some layers are superficial and other layers are deep. If you've seen that picture back where the Zucker-Kindle fascia, you've seen all the different layers of the fascia. We've got layers for the visceral organs, you've got layers for the ligaments, you've got layers for the muscle. Each muscle has got multiple different layers of fascia inside there for the different fibers. And them fibers that go through to separate the muscle actually come through and make the ligament. So then you've got one end of the muscle and you've got the other end of the muscle where there's ligaments. That ligament is the same fibers, but tighter bunches of the collagen that make up the muscle fibers. What is the role of so much fascia? There's an architectural role. It's to organize the tissue and the organs. It creates rooms for the structures because we want the fascia to help surround one structure and surrounds another structure to help create space and allows them to glide. Because when that doesn't glide, then you start to have problems. It plays a circulatory role in the lymphatic vessels that support the fascia. The fascia is a tube with a fluid that moves and through and bathes the cells, and the same with the collagen. And as that water moves through the tubes, it kind of moves through a process called the primary respiratory mechanism, PRM. So I don't know if there's many osteopaths that are in this group here, or some people that do some cranial sacral work. Most of that is based on the movement of the PRM. It kind of flows in about 6 to 12 cycles in a minute. It's not to be mistaken for your respiratory system, but this PRM is the movement of life. It's the movement of fluids through the body. It works with the cranial. We touch a little bit on this in the course. but we go further, if you ever go further down in the ELDOA rabbit hole, is we start to teach teach people how to do ELDOAs for the cranial bones themselves. A little anatomy, as we're talking more into there. And when I talk about the anatomy, we've got fascia that surrounds everything. The goal here when I'm doing the courses is not to let you to know names, and it's easy to name the pec, to name the bicep, to just name muscles, to name structures. The goal is for you to think of the link, right? What stuff links to, when it moves, what does it do? Yeah. One thing about the course that we're doing is we're dealing with the spine. That's the main ELDOAs. We're going to work from C2 to C3 all the way down to L5 and S1. And as you see, all these here, there is an ELDOA to create space on every single one. And so if you've got a problem with somebody who's got T8, T9, now you treat that, you do what you're going to do in your practice, then you can get them to go home and you can do that ELDOA to create that space between T8 and T9. And so the spine is a complex, multi-directional mechanical structure. So it provides a bony canal for protection of the spinal cord. So that runs down the foramen, the posterior part of the spine. The spine is not a rigid rod. We all know that, but I need to keep saying this, is that still people think this way. It's made up of 33 to 34 bones, yeah? And when I say that, that's including the sacrum and the coccyx, which start to fuse. But over time, we've got the main 24 bones that are mobile of the spine, and they all have a role according to the movement. And as I go back to the facet joint, is that facet joint. So if you follow up the spine, it all has a different angle, starting at the lumbar spine with a more parallel and vertical. They go all the way up to the top of the spine where they're flat. And that allows for get up to the top for more rotation when you get up to C0, C1, C2. There's 4 classic curvatures. Yeah. So we've got the cervical, we've got the thoracic, lumbar, and sacral curvatures. When you look at somebody's spine, you might see they've got too much lordotic curve or too much kyphotic curve. What can you do to help that, or give them tools? Give them an ELDOA so they can work on the curvatures. You can work on the points at the middle of the curvature. For instance, in the thoracic spine, T6, T7 is the most posterior part of the thoracic spine, where everybody ends up being forwards, this forward head posture. You can give that for people that work on the desks. Each vertebra is separated by an intervertebral disc, as we see that there, all the way up apart from C1, C2. Yeah, that's where C1, C2, the atlas and axis. They're all connected together by strong ligaments. We'll go into that in a little bit more in a second, and supported by muscles and connective tissue. Connective tissue, and I say that, is I kind of refer to fascia as connective tissue more than just saying fascia, because that's what it is. It's a tissue that connects everything into the body. I think is a much better name for it. Is everybody still with me? Hope so. It's kind of funny when I'm just talking to screens because I don't really know what's going on. I don't see reactions. And this
We're doing fantastic here, Paul.
Okay, cool. That's great. This is a disc. Yeah, everybody knows what the disc is. It's the fibrocartilages. And we're just kind of reading what's here, and we'll go into a little bit deeper. Fibrocartilaginous joint between 2 vertebral bodies. There is a disc between each vertebra from C2 to L5S1. It's made up of 2 parts. The annulus fibrosus, this is the protective layer. It's on the outside here. Nucleus pulposus is the inside part, composed mostly of water. It's got to be really hydrated. We want to get water into there. The nucleus acts like a ball. Yeah, it's got 2 surfaces, above and below. Each disc provides a small bit of movement here. This is what's interesting. We just kind of think it was like a cushion between the vertebrae. And it allows a little bit of extension, allows a little bit of side bending, a little bit of rotation, but all together, when you stack them all up, this is where you get the movement from the spine. And the disc again is broken up into 2 parts. The annulus is a fascia. It's a connective tissue. Yeah, when I say that it's got a connective tissue, it's not only just a shock absorber, there's many attachments that attach on to the annulus. Yeah, Or up and down the spine at the front, you've got the anterior longitudinal ligament that attaches onto the spine. On the back of the vertebral body, you've got the PLL, posterior longitudinal ligament, that attaches onto the spine. Your psoas muscle attaches onto the disc. Yeah, the disc, it comes round. So there's a lot of communication as a disc moves one way, it's going to affect something that's attached onto the other side of it. When you start to think of this connection around the bone, yeah, of the vertebral body, there's a skin. Skin's called the periosteum. The periosteum, that's fascia. Now you've got ligaments now, the ALL on the front, just use that as an example, that attaches to the vertebral body by the periosteum. There's periosteum in the posterior part. So now you've got attachments that go all the way around that vertebral body, connecting two ligaments at the front and the back, just on that body, the same as with the disc. So you just got to think of all this stuff and how it all links together. And this is what the ELDOA really does, is when we learn these fascial links, this is where we can create a position for the body to help fix one point and create space on the other point to allow the disc to be free. Also for stimulation. And the stimulation for the disc is really key, because hydration and back pain, the discs are shock absorbers that keep the bones from rubbing together, but the discs are unable to do their job unless they're fully hydrated. The cushioning ability of the disc is based on the water content. Dehydration, they thin out and lead to degeneration and back pain. So this is where I said, when you explain this to your client, or the disc is like a sponge, when it's crushed together, there's no water in it. When it creates space, that water is allowed to come in. But really what happens here is a process called GAG, glycosaminoglycan, and this is the movement or the kind of osmosis water movement in there. So the disc isn't really like a sponge. These substances inside the disc have ions, and they can allow positive and negative movement of water. So when there's an imbalancement of the positive or negative, this will draw water in or draw water out. And when it's more crushed or more pressed and compressed, there's less negative ions. Yeah, so then there's not a balance. So we want to create space, and as you stimulate that, the positive negative ions try and balance themselves out. This is going to bring the water into the disc. It's much easier to tell your client about a sponge, yeah, rather than kind of going into physiology about this. But the glycosaminoglycan movement, the GAG, is kind of fundamental of what we're trying to do to get the movement of that fluid to come into the disc. Because once that disc has fluid in it, it fills up. Yeah, it's going to create more space to allow the vertebral bodies to be apart. So also when it's not getting pressed and you don't get things like the herniations and all this, when you start pressing on to your spinal cord. You can look up, so I'm not making up with these things about the gags. You can actually just Google and type in gag. It actually goes into the physiological thing of the process of that. Ligaments. Ligaments, as I said, is the proprioceptive part of the spine. Yeah, we've got ligaments that run down the front. We've got the ALL, we mentioned that. But if you look here, yeah, you actually see it attaches to the top of the vertebral body, to the bottom of the vertebral body, and to the disc. Yeah, and that runs all the way up. Then you have the disc itself. Then you've got the PLL, posterior. It's a bit more contact onto the body, but look, attaches onto the disc. Yeah, at the side we do have the psoas. Do you think you know why these attach to the disc? The reason being is they kind of act like a brake. So if you've got the vertebral body and if you go into flexion, when you go into flexion, the disc gets pressed more anterior, so it wants to move posterior. But by having the ligament at the front holding on to that, it doesn't really allow that to happen. Otherwise, all the discs would fall out. The same if you go into extension, which is a little bit more limited by the facet joints and the spinous processes. Again, that stops that disc being pushed forwards. So these ligaments create this great proprioceptive mechanism of not only how the vertebral bodies move, but for the positions of the disc. Then we've got more ligaments. We've got ligamentum flavum, which runs at the posterior part of the of the foramen. We've also got the interspinous ligaments, and then you've got the longitudinal ligament that runs on the back of the posterior of all the spinous processes. Again, these ligaments give information of proprioception for the quality of the movement of the vertebra. This is what I'm saying what the ELDOA does, is when you stimulate this, it's creating these signals back through the mechanoreceptors to the brain to improve the quality of the movement. So not only are you making space to help with a problem, if you've got a problem with the disc at L5S1 that's just pressing on the nerve, you're also creating the space and creating the quality of that movement to improve the movement of that. I'm gonna go on. So we've talked about the ligaments. The muscles are what are going to help do the job. So the muscles is around this, and the fascia that connects the muscles and the fascial connections through the system. This first picture here is the more superficial part, and you can see the thoracolumbar fascia, and you see the fascia that runs up the spine, the fascia that comes off from the traps. All these are all in link, yeah, all in link. And during the ELDOAs, we're going to learn, or you come to the course, you're going to figure out, because the great thing about the course is not, we don't give you the answer. I'm wanting you to work and try to learn and try and figure it out. You're going to try and move the body and use ways of putting the limbs into tension to create space or to create a fixed point of the vertebral body you want to move, and in the lower limb to create tension to try and fix the vertebral body. Then you've got the more middle layers. You've got the serratus, posterior inferior, inferior at the bottom, the superior here. You've got the spinous muscles that are running up the sides here. Yeah, and then this here, this picture here with the smallest muscles, this is where we're affecting the ELDOA. This is, again, what we're stimulating, where we're working, what I said at the beginning, to do with extreme range, the strengthening part. There's a lot of muscles. You've got the intertransverse variate, you've got the interspinous muscles, you've got the rotators. They all have roles. So the intertransverse variate muscles go from the TVP, the transverse processes, to the transverse processes. They're meant to do lateral flexion. Your interspinous muscles that go from the spinous process to the next spinous process. You've got the rotators that go from the spinous process to the transverse processes. Such small muscles, but they're running down between each vertebra all the way down. So kind of what we put in place is, rather than naming them individually, we kind of name them as the transverse spinalis group. It's just easier because they all cross the spine. But these are what the guys that we're going to stimulate when we do the ELDOA and doing that extreme range. Because when you put that tension into there from back, say, L5S1, is you're making these muscles become stronger by taking them to their end range. And when by doing that, that means they can maintain that length to maintain that space. So after you've done the ELDOAs over time, you're strengthening it so that space is there, rather than doing a passive exercise like people use a table when they can lie down and kind of do more traction. When you come back up, that compression happens again. Basically, how does it happen? So as I say, we're going to use fascial chains. We're going to create space. We're going to use the arms. We're going to use the upper limbs. We're going to use all the muscles and the tissue to fix a vertebra above. We're going to use the lower limbs to get in a position to help lock down the vertebra below. And then you're going to push, and you're going to do that extreme contraction to help create that space. The reason why we do keep talking about space, especially for this ELDOA 1 and 2, is for the discs, for degeneration in the disc. You've got damaged discs, you've got bone spurs, you've got herniations, you've got discs that are just going to press on the vertebra, you've got discs that are pressing a different structure where it causes pain. When you do the ELDOA, you're going to take that pressure off the disc. It's going to make people feel so much better. We just talked a lot about pain and using the ELDOA. The ELDOA is just not just for pain. We use it a lot. I use it a lot in my practice for athletes and for sports performance. You've got a skier there. That's what we do a lot there. There's a lot of impact coming into there, but there's also required a lot of mobility. And in that, if you can create spinal mobility, that's going to help spread the load through the body, help spread the load through the hips. There's ELDOAs for the hips, spread the load through the pelvis. There's ELDOAs for the pelvis to help that all move. So if you've got athletes, if you work with golfers and you're working on rotation, if you work on, for instance, T8, T9 as a central rotation of the spine, by doing the ELDOA, it's going to help maintain that. You can do the ELDOAs for the ribs, for the thoracic cage, to help improve more rotation for the thoracic cage. For other ELDOAs and other levels, you can work ELDOAs for the clavicle, for the SCC joint, for the AC joint, for the glenohumeral joint. All this will help golfers, track and field athletes, skiers, kayakers, anybody who's doing a sport or needing to get more awareness of the joint. One thing that Guy always said, and when we created the ELDOA, was you are your own best therapist. You're now getting into the point with these techniques is you're giving tools to your clients so they can do these exercises at home after having a little bit of coaching. And it's such an amazing tool, I feel, that you're giving them something that really works. And they can feel a difference when they start doing this. If somebody comes in and they've got sciatic pain and they're in so much pain, but you've only got 45 minutes or an hour to treat them, depending how long your sessions are, you can get them, help them a little bit, but they're still going to be in that pain until you create that space to take the pressure off the sciatic nerve that's coming from the lower lumbar area. But you give them a tool like the ELDOA, who's going to start creating that space. They've got something they can do at home that really is effective, and it's such an amazing thing to have and hand over to people. So that's kind of a lot about what the ELDOA is itself. It's kind of broken down in the certification levels. The one that we're doing coming up very soon is the ELDOA level 1 and 2. And like it says, it's bringing together level 1, which is the most frequently used ELDOA postures of the spine, and to the gravity line, and bringing ELDOA 2, which is all the rest of the levels of the spine. So basically in this course, you're going to get the ELDOA for C2 to C3, all the way down to L5S1. We're going to learn about biomechanics. And it's not about just biomechanics, how something moves. It's biomechanics, how something moves in relationship to other things. And we're going to learn about tensegrity anatomy, and that's again, is how things move according to other things. We're going to learn about factors of progression, so you can get anybody to do an ELDOA. The ELDOAs are for anybody at any level and any pain. We can get them to do something that's going to improve them with every day they get a little bit better. So it doesn't matter if it's somebody that's just out of surgery or whatever, you can have an ELDOA for anybody. That's the level 1 and 2. Level 3 is going to more into focus on the rib cage, the shoulder complex and the hips. Like I said, we do use for the clavicle, the glenohumeral joint, the rib cage, and the hip. Level 4, it's a lot of courses. Level 4 gets a bit serious. We've got an actual practical exam and a written exam on levels 2 and level 3. But into level 4, you start to learn about the pelvic and the sacroiliac joints. This guy here. In Guy's way, when he's came up with this, he's got 22 different axes of the pelvis and how to test these. And what these actually do, they have a relationship to how the spine is affected, and also how the lower limbs are affected in relationship to which axis is working there. And in the level 4, you'll learn tests to do for that and how to apply different ELDOAs according to that test. And again, you have an exam on the previous ELDOAs you've learned and a written exam on the history of the ELDOA and how it works. And at that point, you pass and you become an ELDOA trainer. Then there's level 5 and level 6. These get into more of ELDOA specialists, going into spinal pathologies, looking a lot more into how you can create a program for somebody with severe scoliosis, for spinal rods, working on the TMJ, upper cervical spine. And then level 6, you start working in how to create ELDOAs for specific pathologies. If they've got a problem with a disc that's out on the left side of the foramen, you can create the ELDOA so you can open up that space. So there's so many different levels to do, but the best course I say into there is the level 1 and 2. You walk out there with all them ELDOAs for the spine in your tool bag that you can kind of implement straight into your practice. On to that. So as I say in the ELDOA, there's so many different levels from there. It's kind of part of a bigger picture of a paradigm of a whole different thing that Guy kind of created. People are coming in because of the ELDOA, but there's a faction called somatherapy, which is the treatment side, and there's a faction called soma training, and this is where soma training came, where the ELDOA came from. It was originally taught in 2 3-day courses. It got really complicated. We were having to go to the class multiple times to try and figure it out. And it was at that point we decided to kind of split it up into these 6 different levels, which makes it a lot more user-friendly. And it's all in a space where we can actually try one if you haven't tried an ELDOA before. Maybe.
I mean, people are going to be more than welcome to give this a whirl. If you're watching and you actually have the space to give this a whirl, it wouldn't hurt to walk a few people through it.
If you're going to do it. So, can we see me? Can you put me in a bigger screen? Can we try that?
Yep. Give me 1 second. We will stop your sharing for now, and at this point it'll be up to everyone else to kind of prioritize your view.
So basically with that, if you can see me on the bigger screen, we're going to try just so you get an experience of it. This is an ELDOA for T8, T9, center of the spine. Can you see me?
Yep.
I'm a full screen. So if everybody comes and sits on their sit bones, you're going to bend your knees at 90 degrees and have your heels in line with your sit bones. You kind of need to do as I say, not as I do. Like I said, I had shoulder surgery in my left arm, so I'm not that mobile there yet. So everyone sit. You have your knees bent roughly about 90 degrees and grab onto your shins. And I want you to pull up straight and get your spine as straight as you can. Really use your arms. Think about trying to elongate the spine and get tall through the crown of your head, the first step. Your arms are going to be doing the work. Really lift up and push that sternum forwards and flatten that thoracic spine. Now, once you're maintaining that with your arms, I'm going to talk a little bit about your head. I want you to keep your chin parallel to the floor, and you're going to bring your head back. So you're trying to flatten the curvature of your cervical spine to bring that more in line so your head's not poking forwards. Still using your arms to get tall. Now, think about your sit bones and your pelvis. You're going to roll off your sit bones back a little bit and roll forwards back onto your sit bones. You're going to roll back off the sit bones, and you're going to roll back onto your sit bones using your arms. Just let the pelvis move back and roll up. Pelvis move back and roll up and sit tall. Really use your arms to pull yourself upright onto your sit bones. Keep the spine straight. Bring your chin back. Keep it parallel to the floor. Now I want to maintain the spine, maintain the head, and think about pushing up through the crown of your head. Axial extension up to the ceiling. You're going to bring one arm out in front. You're going to bend the wrist. You have your fingertips pointing to the ceiling. Then you're going to externally rotate your arm. So now the elbow crease is facing up, but think about turning it more from the humerus and the glenohumeral joint. You're going to do the same with the other arm, external rotation. Now, as you get that maximum external rotation, go back. Can you tuck your chin in? Can you keep your spine straight? Can you push the crown of the head up to the ceiling? Breathing and keeping your arms in external rotation, and push your hands forwards to me. Push your hands forwards. Keep the spine straight. Tuck your chin in. Now, maintaining all the spine and the head and the axial extension, keep pushing your hands. You're going to take them up to the ceiling so they're vertical. And now I want you to push your arms up to the ceiling, maximum tension. Keep reaching up. Tuck your chin in. Both your arms should be up in the air. Onto your sit bones, keep the spine straight. We're going to hold this for a minute. Keep pushing up. Keep breathing. Maximum tension. And when your arms go up, 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 up to the ceiling, keep that chin in. Keep your crown of the head going up. Straighten up the spine. Don't let your spine roll back. Don't roll off your sit bones. Roll back onto your sit bones. Lift up your sternum. Push that sternum forward. Tuck your chin in. Keep pushing the crown of the head up to the ceiling. Now, don't let your knees fall out. Keep your legs vertical. Keep the legs vertical as you can. Both your arms are still pushing up. Maximum tension. I am timing you here. Breathing and pushing up. Push up. Push up. Keep breathing. Pushing the hands up. Maintaining everything you've got. The spine is straight. The chin is in. Axial extension. Bring one arm down. Grab onto your shins. Hold yourself upright. Bring the other arm down, grab onto your shin, hold yourself upright. And then just relax the spine, but stay nice and tall. And then just slowly relax. So that was a little one ELDOA for T8, T9. There's something like that for every vertebra down the body. They are work, but they are training. And they're just really excellent.
That nearly
what was that?
But I was sitting on the floor doing that whole thing, just vibrating the whole time, and now
vibrating. Does anybody have any questions?
So, Paul, just to verify this for my own recollection, and because I'm sure there's a lot of people here asking, so Soma training and Soma therapy are kind of two parallel paths. They're kind of self-explanatory. One is training, one is therapy. But Soma training, the first few levels of ELDOA especially, they're good for trainers, right? For strength coaches, for personal trainers, for those sorts of things.
Yes, totally. So the ELDOA all the way up to level 4 is good for strength coaches, personal trainers, Pilates teachers, anybody that's is dealing with people that do exercise. Okay. It's for everybody. It's like they can be utilized into any context of anybody that's providing exercise. Even like a coach for a soccer team that doesn't really do training, they can bring that in and they can get their players to do that at the end of a match.
Actually, that's probably most of the people that I know that do ELDOA regularly are either physios, athletic therapists, kinesiologists, or strength coaches that work with teams. And a lot of it is because they don't have the capacity to get their hands on people and they still want to affect a change, or they have so many people that they need to be able to hopefully give them some kind of change without seeing them one-on-one. And I've seen a lot of people do that over the years.
Yeah, totally. And the teams, we've done quite a few consults with the team, and they're kind of bringing it in to get their players to do that. You've got one-on-one, you can work on one-on-one level as well. It's really amazing.
Cool. So because I know we're getting close to an hour, I'm going to let everyone else that is here know one thing. So the early bird just expired for the course. We've only got 4 seats left for this course, by the way, but the early bird just expired for the course. If you do want to come to the course and you have not signed up yet, use the code SCOTTISH when you go to checkout
not Irish.
On the website. Because he's not Irish, use the code SCOTTISH when you go to checkout, and it will actually knock the price back to the early bird price that we originally had if you're considering signing up after watching this. So for anyone that's here, feel free to use that. It'll knock a couple $100 off the price, and it's coming up in about 4 weeks at this point. But anyway, for now, back to Q&A. Anybody else have any specific questions they want to throw into the chat box? I mean, if not, I've got a million of them, but...
By the way, please, I find about much more with the class, having interaction is so much better. Having there.
Cool. So you think the level 1 and 2, what do we cover again in the level 1 and 2 specifically before we get to the upper levels?
So basically, you're going to walk away with the ELDOA for all the spine from C2, C3 to L5, S1.
Oh, wow, so, nice. Okay.
Yeah, so that's a lot of ELDOAs you've got there, and you can implement them straight away with yourself, to your clients, to kind of any kind of demographic of people that you work with. Beautiful. And along the lines is there, not only do you get with the ELDOA, we go through what I call as an osteoarticulated warm-up. Is going to learn how to specifically warm up the joints for pre-ELDOA, pre-exercise that can be utilized for factors of progression of how to get into the ELDOAs for different levels, different demographics, which the factor of progression are training within itself. Awareness exercises, again, because if you don't know where something is you need to help train that person. So we're going to go through all that in the course as well.
Beautiful. Oh, not sure why my video stopped there. So one of the things I really like about this, just as a principle, having not actually taken the course yet, so I can't speak to it yet, but as a principle, is I spent many years in clinical practice giving a lot of people exercises that fit into a lot of different systems, but a lot of them were not designed to be specific to a specific area or problem. So I was doing a lot of McGill Big Three and a whole variety of those. A lot of things based on the FMS or the SFMA. At a certain point, it switched to, or I shouldn't say it switched, but I started integrating a lot of DNS-based principles as well. And then a few things from various other kind of systems and approaches I've learned over the years. So one of the things I really like about this, that the prospect of this, is that it will give me the ability not to just throw those out and say, oh, we're just doing ELDOA, but to integrate something that is hopefully going to be much more specific to the segments that I'm working with a lot of the time. You know, just being a chiropractor, I spent a lot of time. It was almost all shoulders and spines is what I spent a lot of time with.
100%. And it's like the how specific you can get with this. It just kind of opens more doors for your treatment, for your training, because the body is specific. You need to be able to know what area is covering the lesion, and then you're going to have a tool that can affect that. So somebody if for a chiropractor, for instance, if you release or you do an adjustment for T8, T9, boom, that's perfect. You've adjusted that. Then you can give this tool to the person to maintain that space to help normalize the tissue for what you've just adjusted. If you're a trainer and you've got somebody that's got low back pain, you're going to say, okay, I might not be able to assess them. I might not be able to put hands on, but I could just say, where does low back pain normally come from? L5S1, they'll do that ELDOA. You've got a little bit of increased lordotic curve when they run. Maybe that causes their back pain. What's the center of the lumbar spine? Oh, it's L2, L3. I can give them that ELDOA. So there's so many different ways that you can do that. And it's just how creative you want to be, but you're giving tools that you can be really specific with.
Yeah, I've seen that over time with mostly with strength coaches, is that if they're working with a specific population that causes that their sport or whatever they do causes them to move in a prototypical way. So for instance, hockey players move in a very prototypical way. Basketball players tend to move in a very prototypical way. What a lot of them will do is start to integrate different ELDOAs depending on how the practice went that day, or depending specifically on the sport if they work across a bunch of different sports. And I part of me feels a little skeptical about it, but then part of me goes, man, it's better for them to integrate this stuff than to just pretend that their practice and their sport wasn't costing them anything. So I've seen some good coaches do that over time and say, you know what, like today, or they've even just spread it out throughout the week, you know, like every Monday we do this sort of thing. So we end with an L5S1 ELDOA. Later on in the week, we do these other few things. And I think it's a pretty safe and awesome approach to be able to integrate.
And that's the thing, is saying, but some of them is like everybody should do L5S1. So every client I have that comes in, everybody gets L5S1. It's the last vertebra in the body. The whole upper body sits on that disc.
Yeah.
Why wouldn't you not do that? There's certain ELDOAs that we talk about going through that relate to the gravity line. So L5S1, L2, L3, T8, T9, T67, C4, C5. Now they all relate to the gravity line and posture and the different positions of the spinal curve, or the most anterior in a lordotic curve, and the most posterior in a kyphotic curve. Also the center of rotation. Theoretically, that's where all the load is transmitted through everyday life. You can just give that to people. That's going to help improve their posture. You know, with improving your posture, as simple as a couple of minutes a day, it's amazing.
It's beautiful. All right, we're going to wrap it up here because I know a bunch of people are in the middle of a day of seeing patients. Unlike me and you, we're the slackers of this crew. So yeah. we're gonna call it at that.